Thank you, everyone. My name is Duncombe, and thank you for the opportunity of speaking today. I'm here today to talk about developing an aortic service to care for the growing number of patients with thoracic aortic disease. So just a little bit of background. We felt that this was needed because we felt there's insufficient evidence to predict how the aorta is affected by disease, but careful surveillance and timely management can contribute to the patient's outcome. Given the complexity of these patients' needs, we required a service to focus on the patient's aorta as a whole. So, 5 areas that we thought were important in developing the service. We wanted to integrate those specialties with a multidisciplinary and holistic approach to the patient's care. We wanted to provide consistent surveillance and intervention in accordance with all the current guidelines. We wanted to improve the education and reduce the risk factors associated with thoracic aortic disease. We want to utilise our current resources, so reduce the amount of multiple trips patients were having and unnecessary tests. But all of this ultimately was to try and improve the patient outcome and the patient's experience. So this is how we went about doing it. So we wanted to produce a patient information leaflet to improve education. We wanted kind of a nursing team to support the patients and their relatives. A structured pathway to improve the imaging and the consultation process. And this one-stop clinic principle where patients could have their imaging and consultation within one visit to us. And then regular MDT meetings. So we looked back at previous referrals to get a sense of what was been previously going on. So looking at the origin of referrals and the outcome from the clinics. And we looked at one of our 3 aortic consultants from January to December 2015. So there was 105 patients that were referred to us. This is the breakdown of where the patients were referred from. So 50% are referred from cardiologists either internally or externally. 26% from the GPs. 13% from the vascular, either internally and DGHs. And then there's 7% of a group of, unexpected sources of respiratory geriatricians and oncologists where they're increasing their imaging and therefore finding these sort of aneurysms and diseases. So the results and what we found from the clinic. Well, 44% of these patients were new referrals to us. 59% of them went on to continue to have surveillance for patients who have growing aneurysms, bicuspid valves, or patients who had intervention already and we were looking at their native aorta. 24% required intervention by a cardiac surgeon. And then 8% were referred on to other members of the MDT. So further results. We developed our leaflet, and that's available on the website and available to patients in clinic or if they come in as an emergency referrals. And this is just a snapshot of what it looks like. And patients were saying that they had this kind of weight over them. They didn't know what was, they had no support or anyone to turn to. And we produced this leaflet in conjunction with patients to give them a little bit more of education and advice and support. We established a pathway through the service to provide consistency, and this is what our pathway looks like. So the patients are referred, they are accepted by a surgeon, and if they haven't had imaging prior to that, we're using this one-stop principle, imaging and consultation, and then they either follow two pathways, the right side, the surgical pathway, the surveillance pathway. The surgical side, they have their surgery, and then at a 6-week follow-up, they see a consultant instead of a reg. And from that, they either decide whether they need continuing monitoring and surveillance, or whether they go on to be discharged, which leads me to the surveillance side of things. Same initial referral process, and then see them in the initial consultation and decide if they're going to be under the surveillance. So imaging at 6 months, 18 months, and then from that they either decide if they're going to go for surgery, get discharged, or get referred on to a colleague. So further results. We established the one-stop principle. And we're also trialling virtual clinics where patients have their CT scans either locally or with us, and we provide feedback in the form of letters and phone calls to update them, and then don't see them as regularly in clinic, but you know, that we see them yearly or 18 monthly. Patients receive a more consistent service, and we've got a multidisciplinary holistic approach to our patients now. So this is our aortic MDT setup, involved with cardiac, vascular surgeons, cardiologists, adult congenital team, interventional radiologists and radiologists, geneticists and nurse specialists. So what can we conclude about all of this? Well, the 24% of the patients went on to require surgery. And also on top of that, increasing number of patients being referred from other specialties, all just supports the claim that there's a growing need for this service within our trust. The regular MDTs have improved our consistency and efficiency between our specialties. But also the continuous surveillance of patients who've had intervention is helping us understand the natural history process of these diseases. It's enabling us to support these patients and families through quite difficult times, and allowing us to help promote and support research. So what's the future? Well, we would like to standardise these pathways on a national level. We'd like to continue with our surveillance and treatment and focus on the aorta as a whole, because we believe that surveillance can reduce the number of urgent and emergency referrals, and in doing that, improve the survival and the patient's outcomes. And the future of our clinic will continue with the one-stop principle. We'd like to have more nurse-led support with clinics, improving education support to encourage more lifestyle changes, continue the virtual clinics, but also more audit and patient, audit our patient feedback and the patient satisfaction with our service. Okay, just in summary, as guidelines change and we understand more about the disease process of the aorta, the number of patients requiring a dedicated aortic service will continue to grow. Thank you very much.